massive value for Public Health England in understanding the contribution of sport, culture, communities, work and learning to overall health. If you think about health as something much more than the absence of illness, much more than what goes on inside the NHS services, so to be able to have a dialogue about expanding health beyond narrow health or medical confines is absolutely vital.
There are a number of factors policymakers have to look at when they're designing policies for communities and for people. Economic measures are one key area, but there are a range of other things they need to look at. And well-being is about exploring what those other measures are. At the minute, areas that are looked at are things like health, where we live, our education, and importantly, relationships between other people and government. And the last two, about relationships and community and government, is why community wellbeing is important.
There are lots of benefits in considering wellbeing, but the most fundamental thing is that we consider the impact of our decision making on people, their lives and their experiences, and those of their communities as well. So government decisions can often be very complex, and it's easy to think about the legal, the economic and the financial implications and the processes around that. But considering well-being just allows a little bit of time and space to think about how our decision making is going to impact on people and what's really important to them. So we can ask ourselves, based on the growing body of evidence around well-being, how is our policy, how is our intervention going to help people to lead a good and fulfilling life? Is it going to enhance their well-being? Is it going to improve their quality of life? So for us, it's really about informing decision making, making better people-based decisions and better outcomes.
If communities don't have a greater sense of cohesiveness, if communities aren't participating in the production of local health and well-being, then they're often disenfranchised. They're often alienated from the things that should be promoting the good health and well-being. Too often in our culture nowadays, there's a me culture or an I culture. Communities enables us to rescue and resonate and reconnect with that sense of who we are collectively, and that our individual contributions are only valuable because they add to the collective contribution or the collective good. So that sense of communities, strong and connected communities, is vital.
Wellbeing in the community, no more important subject. I don't think we measure our cities and our communities' success simply by the crude measurement that economists give us. And Bristol is a really successful city when measured by economists. And we're the only one that punches above the national average in terms of GDP, that crude measurement that only measures all the big stuff. It measures the nasty stuff as well as the good stuff. And it is absolutely vital that we find a more intelligent, more sensitive, more person-orientated way of measuring these things if we're not to fool ourselves.
Knowing what works enables us to try things. What works, why, where and for whom is an essential part of learning to put in place those things that will be of value to the health and well-being of our communities, our families and ourselves as people.
The centre is important because they're going to be one of the key agencies that will bring together the evidence that will help us understand what well-being is and how we can improve well-being. And the fact that we're looking at it here in Northern Ireland is important because, perhaps surprisingly, on the current measures of well-being, Northern Ireland does very well.
There's been excellent progress on defining what we mean by well-being, and this has been informed by public debate, and also excellent progress around robustly measuring well-being. But the key question is, what works to improve it, and what do we know has been proven to enhance our well-being? There is a growing body of evidence around this, but it's relatively inaccessible. It's often hidden in academic journals and it's in very complex language. So the What Works Centre for Wellbeing is going to play a really important role here in translating this body of evidence into clear, practical and easy to use guidance and advice for policymakers, and also at a local level for local commissioners, businesses and also individuals like yourselves, so they can use this information to inform their everyday decisions.
It's really important to have a place where good practice can be shared, where ideas can be tested, where you can call on expertise, and it's particularly the case that we're in a, shall we say, a low-cost environment. None of us are going to have a real surplus of resources over the next 5-10 years to try to make sure every idea can be made to stretch as far as it can do, and you really get that by understanding what other people have tried and trying to learn from it.
So these dialogues are fundamental to the purpose of finding out what works for whom, where and why, and fundamental for overall health and well-being.
It is really difficult to capture the benefits of policies and interventions such as sports and cultural activities or community learning, where the benefits are far more evidently social than they are financial. So wellbeing science is really helping us to measure the impact on people's lives empirically, but the public dialogues will also help capture and better articulate the impact of these kind of interventions on people's lives and how they enhance their lives and their experiences. So we're hoping that the combination of the wellbeing science and the public dialogues will set the What Works Centre off on the right track to delivering the best possible guidance and advice to those who need it.
We see the community as our primary resource, really. Ideas have got to work in the community for individuals, but actually it's the community that can give us the best feedback about what's working and what isn't. So that process of addressing wellbeing through part of a continuous dialogue with the community, a proper feedback loop so you can understand what's working and what isn't, I think is vital.